Hi, welcome to the Destin Business Forum, brought to you by the Destin Area Chamber of Commerce. I'm your host, Amy Perry, and our guest today is Dr. Poelstra. You are a surgeon with the Spine Institute on the Emerald Coast.
Yes,
ma'am. Did I get that right?
You got it.
Okay, so tell me what the Spine Institute is.
The Spine Institute is a group of physicians who are all spine surgeons providing the whole gamut of spinal care to our patients. So it goes from recommendations for non-operative care, which would include physical therapy, medications, injections, sometimes chiropractic manipulation, to very complex surgical intervention if we need to perform those.
So you don't, it's not like if somebody comes to the Spine Institute, they're automatically going to be in surgery?
Oh, absolutely not. No, surgery is the last resort.
Okay.
Also for us, I might be a spine surgeon, but we try anything and everything to prevent people from having to go to an operation, because you change somebody forever once you perform an operation on them. So we're careful with that. I'm
aware of that. How about braces? Do people still wear like body braces for different things?
Yeah, that's a good question. We have, for our younger population, children that are still growing that might have a scoliosis, sort of a sideways curvature of the spine. There is some evidence for bracing to prevent the curve from getting worse. Because when children grow and they have a curve already, there's a very high chance they might worsen. So when you fall in a certain category, we actually have these people braced for 12, 14, sometimes 23 hours a day. Bracing in adults is slightly different. There is no ability for us with a deformity. If an adult would have somewhat of a scoliosis, or it's called a spondylolisthesis, a slippage phenomenon in the spine, if they would have that, an adult cannot be corrected with a brace.
Because they're not, it's still growing.
Correct,
right?
exactly, exactly. Because you can't affect it positively. What braces can help for is pain control. So if people have a lot of degenerative back pain, which is not a great indication for surgery, we sometimes put a brace on them to make life a little bit more
bearable.
Bearable, yeah, to give them some pain control and to give them maybe a little bit better quality of life. And we use bracing after fractures. Yes. Especially if people have a fracture from some kind of trauma that doesn't require an operation, or older people with what we call an osteoporotic fracture, right, that the bone was not able to tolerate them simply bending over and lifting a bag of mulch or so in the yard. Putting a brace on them and preventing the fracture from having a worse deformity. Then after the fracture is healed, in 6 or 8 weeks, we can take the brace back off, and we were happy we didn't have to do an operation on them.
Oh, that's good news. All right, so that's probably not as sexy as the surgery and all the stuff you have here. I want to talk about. I was telling you before, I have, or had, I guess you always have scoliosis, but I had that, and I had a very lengthy spinal fusion when I was 14, and then I broke my back 5 years later. So I'm familiar with the braces and the cast, and the, I had a Harrington rod. I don't know if they still use those. All right, so this right here.
Correct.
I don't know if you can see that on the camera. I would call that like a bulging disc. You call that a
herniated disc.
This
is a herniated disc. Yeah.
Okay.
So what you have to imagine is that what we look at here is the front of the spine, and so this will be the right side. This is the left side here. So ignore all the rods and screws and things that are in the back. And if you imagine the disc in between the bones here is nothing more than like a jelly-filled donut. So when the pressure becomes a little too high and there is a little rent, maybe in the outside of the donut, some of the jelly might be squeezed out.
And it bulges
out. And that's
out right
exactly what it looks like that.
And what causes the pain? Is it because this is pushing out on nerves out here, or because there's nothing? I mean, it still looks like there's something in there to cushion.
Yeah, there's a combination of factors that cause pain. There's two different types of pain with a disc herniation, for example. There are people that have primarily low back pain because the disc itself is incompetent, and there might be some inflammatory stuff produced because the disc is trying to heal itself.
Okay.
So that causes some back pain, but more importantly, once this jelly material is squeezed out and is in the area where normally a nerve would go by, the nerve has mechanical pressure, and the nerve doesn't like to be pushed on. And the other thing is that this red thing that sits here, this jelly that has been squeezed out, produces a bunch of inflammatory factors, just like if you have a splinter in your finger, it gets red hot and swollen, not because it's infected, but your body is responding to whatever's going on there. So these inflammatory factors are similar to lemon juice for your eye to the nerve root. So it's a very irritating type of response that you would have. And then people get something that we call radiculopathy, pain along the trajectory of the nerve root, all the way into the buttock, into the leg, and it can lead to weakness, but mostly difficulty getting up and around.
So somebody comes in and says, well, my back hurts a little bit, but really I have this numbing or tingling sensation in my legs, or what about hands?
Exactly. This is an example of the lumbar spine here, but this
That's
can also happen. The lower back, correct. That's the lower back attached to your pelvis, but this can also happen in the neck, and in the neck you can have exactly the same symptoms. It's usually a combination of neck pain and then radiating pain over the shoulder all the way down to the forearm and to the hands.
Numbness in your hands.
Numbness and tingling, and you have to imagine that the nerves in our upper extremities and lower extremities can also be affected downstream. So there's a lot of people that think they might have carpal tunnel, right? That gives you also numbness and tingling, but it could be coming from the neck.
Is that cervical,
the cervical
thoracic,
spine, correct. Yeah, you're right. You're right. Those are the 3 regions of the spine.
Okay. I don't have a whole lot of time, but I want to talk about these nifty little things. I know if you have a spinal fusion, which is, explain real quickly what a spinal fusion is.
So a spinal fusion would be to make different motion segments solid. And we don't necessarily do spinal fusions a lot, we do spinal reconstructions because we fuse people for instability or deformity. So it's not like we leave them crooked and just put a bunch of rods and screws in there. We actually reconstruct them and we biomechanically make them straight up again. So you get a reconstruction, and the disadvantage is that your spine would be stiffer from that. Now there are cool nifty devices, as you said, nowadays. They're called disc replacements, and this is an example of it. And what we would do here is go in, take the disc herniation or the instability away, and then we actually put a device in there that allows the spine to move still.
That is amazing.
That's pretty cool.
Now, you actually take the whole disc out in this situation.
Correct.
And there's a replacement. In a herniation, you said that you can sometimes cure that by not doing a full open surgery.
And we don't necessarily take the whole disc out, because the goal is that if this is just a jelly-filled donut that has left some of its contents outside against the nerve, that all we do is we basically clip off that piece that has been squeezed out, and we respect the rest of the disc. So there comes the sort of minimally invasive surgery that we do in place, because we can put a little tube down through a small 1-inch incision. We go right down onto the disc herniation. We take this piece out from in front of the nerve, and we respect the rest of the disc. In the past, people used to take the whole disc out
and then do a fusion.
And then do a fusion, exactly. And nowadays, we just take a little pair of pliers and small tools that we use, and sometimes, you know things about, laser and other things that we do to shrink down the tissue there. Whatever is a sequestered fragment, like a piece that's floating around, we pull that out, and then people go home the same day and
pain's gone. That is amazing.
Yeah.
That's what people are talking about when they say, "Oh, I had surgery yesterday," and they're out walking around. It's amazing to me.
Exactly.
Okay, I have about 30 seconds left. Where is the Spine Institute located? You have several locations?
Yeah, the Spine Institute has a location in Fort Walton Beach, right behind Fort Walton Beach Hospital.
Okay.
We are in Crestview on Main Street, right where the railroad tracks come across to Old Main Street.
Okay.
And we're in Destin, across from the Destin Commons, and more particularly sort of where the Bass Pro Shop is.
Yes.
Right across the street on 98.
Okay, I know it well. And if somebody is having back pain, do they call your place? Do they call the Spine Institute, or do they need to go to their own doctor?
I think you need to have sort of an appropriate amount of sort of reservation about going to see a specialist, right? When you have 2 or 3 days of back pain, don't run to like any specialist right away, right? Have a conversation with your primary care doctor. People don't necessarily need a referral, but most things just get better by themselves. We're always willing to render an opinion. It's always a good idea to come see us. As you already said, we're not ready with the scalpel. We are very conservative in our first approach, so we always welcome people to call, and then they may have to wait a little bit because we're pretty busy, but we render an honest opinion, and we try to stay away from doing surgery and provide a non-operative solution first.
Perfect. I love it. I hope you come back. I could ask you questions for probably 2 hours.
That sounds like it. Yeah.
I love this stuff.
Wonderful.
And I'm interested in it. Come back, okay?
We will.
All right.
Thank you so much.
We'll be back.
Appreciate it. Okay.